So bringing together the concept of vaccines and geoengineering, we're both both of those topics are reaching a point of critical mass and critical perspective in terms of what needs to be done and why we, as Dane said in his little introduction, that we really do need to have an army. And why everyone is here, that everything that you learned today between what I'm gonna say and Dane is gonna say, and watching the movie Vaxxed, if everyone here can commit to, when you go home, to telling at least 5 people, and asking them to tell 5 people, and asking them to tell 5 people, we will start developing the critical mass we need to take back our lives, our power, and our world. So with that, I want to talk about what Dane asked me to talk about today, what we've been working on, is this whole concept of what's coming down the pike for adult vaccinations. I mean, being here in California, I'm sure most people that are here were involved in one way or another with SB 277 and the travesty that happened with that law. And the public health policy, and it's already been written in many of the public health journals, that is to become the model legislation for all 50 states. So it comes down to, people are saying, I'm gonna move to a different state. It may turn out that you can run, but you can't hide from these mass vaccination programs. And the one that really nobody really knows about and is really quite nefarious is this whole concept of adult vaccinations, and they're coming after adults next. So if many people think that they're past childbearing years, they don't have children, you might have grandchildren but feel like you don't have much of a say, it's going to, these mandates that are coming down the road very quickly, as you'll see, are going to affect every adult sitting in this room. So I'm going to start out this morning. It's pretty early, but we're going to start with a little bit of a history lesson. I always like to talk about starting with a bit of history, because if we get a better understanding of where we've come from and how we've gotten here, perhaps we'll make different choices going forward to not repeat the same types of errors. So at the beginning of public health started way back with the whole concept of quarantine. And quarantine actually happened in the 1600s, when colonies were a series of cities along our eastern seaboards. It just started with a bunch of little villages, a bunch of little things that turned out to be colonies. Ships were arriving from infected ports, and at that point in time, not only in the US, but also in Europe, they were required to sit out at sea for 40 days before passengers could come on shore. And that way, if anybody was sick, either they had a time to recover or they had time to die before they came on board, and they carried infectious diseases with them. The slave trade spread yellow fever from Africa. A lot of Russians and Europeans brought typhoid and cholera. So it was really kind of an unhealthy time. Now, what was really interesting is if you go back and you look at all of the historical backdrop, everybody thinks about smallpox and smallpox going around the world killing everyone. Well, back in the 1600s, even then, smallpox was more of a filth disease, just like cholera and typhoid, and it was way down on the list of concerns when it came to quarantine. So fast forward a little bit, about 100 years, and the first US Quarantine Act was passed in 1701. Think about that. It was before the Declaration of Independence, it was before our Constitution. So in 1701, they passed this Quarantine Act to try to cut down on the infectious disease burden. 1798, the Marine Hospital Service was established by the Act of Relief for Sick and Disabled Seamen Act. It was funded and run through the U.S. Department of Treasury, and it was actually the first national health care program that we had in the United States, because sailors were required to pay 10 cents a month into the national treasury in order to take care of their families and to take care of their health when they came back from sea and they happened to be sick. So the Obamacare, circa 1798. And to put that a little bit in context, it was in 1799 that Genter, quote, invented the smallpox vaccine. So you can see that the whole concept of infectious disease and trying to prevent against it has been going on for a really long time. So public health we're going to fast forward about 50 years to about 1850, and where the whole concept of cities and all of think about historical backdrop. I mean, this is right before the Civil War, and so this was about the period of time that the cities in the north and the south were starting to become real cities with lots of people and lots of commerce and things going on at that point. There were waves of massive numbers of immigrants coming in from America and Russia. And this was an example. If you've ever been in the New York Harbor, if you've traveled at all, just think about this. That in this very short period of time, between September 1st and October 14th, so about 6 weeks, in 1892, almost 1,000 vessels and nearly 81,000 passengers entered the port of New York. Think about the mass of humanity that were coming with carrying just what they could carry, some of them coming across the Atlantic Ocean in steerage where there was no toilets, no anything that we know today in terms of travel, and no TSA. Maybe that's not so bad. So the combination of filth, cramped quarters, and malnutrition was the perfect storm for the epidemics of cholera and typhoid fever, both spread by fecal contamination. So also think about what cities were like at that time, not only in the US, but Europe. We had no public sanitation. There was the whole idea of the honey buckets, where people actually went to bathroom and toilets in buckets and then they threw them over their balconies, which historically is why, walking down the street, why the men walked on the outside of the women when you walked down the street on a sidewalk, was so that they would get the honey bucket or get the slosh that was coming up from the horses in the street. So just put that in context in terms of the filth that was going on during that period of time. And many people were sick and many people were dying, but it was due to lack of hygiene. So public health was really needed at that point in time. We needed to clean things up. We needed to learn about things like soap and water and put public sanitation in place and pipes and all the things that were built during that period of time. And by 1900, this was the state of what the US cities were actually looking like. Life in urban slums was filled with overcrowding and unsanitary living conditions. Tenements housed 4 or more people in stifling, windowless, poorly ventilated rooms, many times 4 or 5 stories below the street level. Oops. The Lower East Side of New York smelled like rotting fish, putrid meat, and decaying vegetables. The immense amount of animal waste in the streets from horse-drawn wagons and trucks, and the stench of 82,000 unclean humans was a cesspool for infectious disease. So is it any wonder that there was a lot of concern about building a public health department and a public way and a public sanitation? This came from a public health document from the US government. So this is what we were talking about during that period of time with the horse-drawn carriages and dead animals, and there was no electricity, so that meant no refrigeration, so that even if you bought meat or vegetables, and that the poorest of people always got the leftovers, and some of them still had already begun to rot, and some of them had maggots and things in the meat. And this is during this very poor period of time where there was a lot of sickness. So was a very heavy hand and a very large amount of guidance in terms of developing public health necessary in that period of time 100 years ago? Yes, it actually was. So what they accomplished is that by 1902, 100 years after it was formed, this marine hospital system became the Public Health and Marine Hospital Service, PHMHS for short. For the first 100 years, the Marine Health Service was the public health service in the US. But by that point in time, we weren't getting so much in terms of transients with the shipping up and down the eastern coast. We had more concerns about people that were in cities. And so they had transferred that more from just a marine hospital into public health. It was also funded by the Treasury and used mostly to provide protection at the ports. But we were talking about ports now also up and down the Mississippi River and the ports that were beginning to be developed on the west coast. This changed at the beginning of the 20th century. So what was accomplished? By the early 1930s, just 30 years later, the Public Health Service built sewage treatment centers and began using chlorine in the water and filtration systems to screen out the cholera, the typhoid, and the other types of things that were causing massive amounts of infections and death. And cholera during this period of time was really a very feared disease. It was more feared than smallpox or measles or any of those things because it was a very aggressive form of that pathogen. If you contracted cholera, many people, adults included, not just children, were dead within 48 hours because of massive vomiting and massive watery dehydration. No real hospital systems, nothing like IV fluids, and even if they could keep down any fluids, what kind of dirty water were they drinking? So it was a very feared disease. If you look back at some of the pamphlets and things from that period of time, cholera was the most feared disease of all because of how quickly people could succumb from that. So when they started doing this and they had a public sewage system, this decreased the overall mortality by all infections by 43%. Cholera disappeared. Typhoid fever decreased by 90% within 5 years. Infant and child mortality decreased by 95%. This was 1930s. We don't have raging epidemics of these things anymore. Thank you, public health. But we really don't have raging epidemics of much of anything else either. And I really contribute a lot of that to the public hygiene and public health and refrigeration and sanitation. We don't give enough credit to the fact of electricity that became commonplace in our homes all across the country in the 1950s. It wasn't until the 50s that it became very well, that homes were just routinely wired for plumbing and for electricity. And that was the period of time that when we started having refrigeration and we could go to grocery stores and maintain our food in a closed, either frozen or in a closed environment, that we really started to see the improvement in health and longevity. So 1943, just to put another thing in context, 1943 was the last known smallpox case in the United States, and it was in Texas, 1943. How long did we keep giving smallpox vaccines to the general public? Until 1972. Do we still give smallpox vaccines to the military? Yes, we do. Even though the smallpox has, if you read the public health or the CDC's information, they say that smallpox was eradicated in 1979. Clean water technologies are likely the most important public health interventions of the 20th century. This was a paper that was published in 2004 by two researchers from Harvard University, that public health, the most important intervention in the 20th century was clean water. I want you to just remember that. Stick that in the back of your head of how important that is. And I think we've given just an overview of how important that was, and there are lots of books and lots of papers that are written on that. So the most important thing, clean water. Okay, so what happened? How did we transform our public health service that was doing good things in terms of hygiene and public transportation, and it was 1905 or so when we started to get horseless carriages around the country, so we stopped having all those tons of animal feces in the highway, and we were doing things to really improve public health. How did public health become big government? How did suddenly all of us as individuals and individual humans become the property and so much scrutinized by our federal government? Well, these were just the highlights. What I'm going to show you in the next few minutes are just some highlights of some of the biggest game changers of what happened and how we are now such property and so much concern of the U.S. government. The biggest game changer is when your health became big business, and you became the business of big government, and how the vaccine industry began to boom. This all started, well, that didn't turn out very well, did it? In 1965 was when the Social Security Act was passed, where Medicare and Medicaid came into play. And it was Section 317 that became in the 1960s a permanent funding source for the U.S. government to buy vaccines. In fact, today, the U.S. government is the largest purchaser of vaccines of any individual entity or any individual organization in the world. The U.S. government is the largest purchaser. Now think about that. Think about the pharmaceutical lobbying firms in Washington, D.C., and how hard they push Congress to pass all of these acts so that they can put money into a fund of this 317 fund so that they can be the largest purchasers of vaccines. In 1980, health education and welfare, which a lot of us might remember, and them talking about that during that time, became HHS, Health and Human Services. And in 1986 was when the National Vaccine Injury Compensation Act was passed by Reagan, a Republican, who put it into play because the pharmaceutical industry had gone to him and said, we know that our products cause harm. We know that there's all kinds of health issues that are happening with children because of vaccines. And about that point in time is when Barbara Loeb Fisher had written the book A Shot in the Dark about pertussis causing brain injury because she had a brain injured child from a pertussis vaccine. And the drug companies all pulled out and they said, okay, we're not going to make vaccines anymore unless you pass a law to protect us. We were down to one company in this country that said, everybody's going to pull out except us unless you pass this law for complete tort and liability protection for where people can't sue us for our faulty products. So that was what the National Vaccine Injury Compensation Act did in 1986. It said that you can no longer sue the government, the doctor, the hospital, for any type of injury that might occur if you or your child gets a vaccine injury. Instead, we're going to set up this thing over here called VAERS, which is the Vaccine Adverse Event Reporting System, so that you can start reporting if you have an adverse event. And if you have an adverse event that matches what we think is an adverse event on this fabricated table, then you have a right to make a claim against the US government for compensation through the Federal Court of Claims, which is commonly called the Vaccine Court. It was meant to be a no-fault, no litigious type of claim that you could submit a claim for an injury and get paid. And over the years, it's become extremely litigious. Less than 25% of people who actually submit a claim actually get compensated. And up until very recently, it could take up to 10 years to get the compensation. In the last few years, there have been a few modifications to that if you have a legitimate claim, you might be able to get your money within 3 years. So it was established, at the time that this was passed in 1986, there were only 3 vaccines that were given: MMR, DPT, and polio. Okay, we'll cover them for that, those 3 vaccines, and we won't make a big deal about it, but the acceleration of the schedule began in 1991. And in 1991 is when they added the hepatitis B vaccine at birth. And then they added Hib vaccine at 2 months of age. And then they added chickenpox in 1995. And in 2000, they added Prevnar. And now what happens is that children get 49 doses of 14 different vaccines by the time they're 6 years of age. 49 doses of 14 different vaccines by 6 months of age, and 69 doses of 16 different vaccines by 18 years of age. To think that that's benign and can cause no problems, because what we're actually trying to do with these vaccines is to prevent a fever, a cough, a rash, and some diarrhea, and possibly exchange that for a lifetime of chronic illness, from a long list of neurological problems to ADD, ADHD, asthma, eczema, autoimmune diseases. That we have over 7,000 articles on this from the mainstream medical journals accumulated into the Vaccine Research Library, which is one of our sites. So we have accelerated the schedule, and the pharmaceutical industry still has no liability. In fact, there's the PrEP Act and a few other acts that have come into play in 2005 and since then have protected them even further, that if they create a biological vaccine, one for a pandemic, and it kills a bunch of people, everybody's just out of luck. Because in order for you to have any compensation, even through the vaccine compensation program, you, as an injured party or a death of a family member, would have to convince the US Attorney General's office that the drug companies created this vaccine intentionally to kill you. Really? But that's what the law says, and that's what the protection is. So in 2000, things really started to change, and the Global Alliance for Vaccines and Immunizations was formed. Now, that's a foundation. And what they actually try to do is they started with $750 million pledge from the Bill and Melinda Gates Foundation. To date, the Gates Foundation has pledged over $6.8 billion. Gavi creates a public-private partnership bringing together UN, 60 governments, the vaccine industry, and private sector funding to vaccinate the world. The Gavi board members, there are 28 of them, who have permanent seats, is the CEO of Gavi, Bill and Melinda Gates, UNICEF, the World Bank, the World Health Organization, donor countries, developing countries, reps from all of the vaccine industries, non-governmental organizations, NGOs, independent individuals, and they helped to ramp this whole thing up between 2005 and 2010. Now, why was Gavi created, actually? Well, it's because the powers that be out here, like the Gates Foundations and individuals who want to influence countries to vaccinate kids, because that's how they make their money, how the industry makes its money, even if it's pennies on the dollar, do you think they actually sell those for a loss? I mean, if a vaccine if they sell it to third world countries for 25 cents, it probably costs them half a penny. So you can't just do that directly. You have to have a foundation in the middle over here. Gavi becomes the money that goes into the foundation that then goes to the governments. So that's why Gavi was actually created. But that wasn't enough. That just really wasn't a big enough deal for them. So they decided that we had to wrap it up and had to ramp up things a lot better, and they called, the Gates Foundation declared the decade of 2010 to 2020, the decade of vaccines. And globally what happened is they developed the Global Vaccine Action Plan. In the US, the National Vaccine Action Plan, the Affordable Care Act, Healthy People 2020, and the Adult Vaccination Plan that we're gonna speed through here in the next couple of minutes. So, 2010, the Global Vaccine Action Plan went into play. That was endorsed in 2012 by the 194 members of the World Health Assembly, the supreme decision-making body at the World Health Organization, and the World Health Organization is housed inside of the UN. Other participants included the Bill and Melinda Gates Foundation, United Nations Millennium Project, UN Global Strategy, UNICEF, Gavi, and all governments and all global agencies, all media and all drug companies all over the world specifically united to vaccinate. Let that sink in a minute. Because what are we really trying to prevent in the vast majority of people? A cough, a fever, a rash, and some diarrhea. And vaccines, when they are tested, when they go through clinical trials, they're all tested on healthy people. They screen out healthy people to put them in these drug trials. And as soon as they're approved, they give them to sick people. And don't a lot of those 79 or 69 different ingredients, known carcinogens, human DNA, animal cells, all those other things, quite possibly, when given to sick people, make them sicker? But this is what's happening, and this is where they're going. In 2010, there was the vision, vaccinate every single person in the world, obtain at least a 90% vaccination rate of all currently approved vaccines, and just so you know, there's 140 in the developmental pipeline. Induce and fast-track new vaccines and delivery technologies, evolve vaccination as a cornerstone of every country's health system, and integrate surveillance into the system so no one is missed. These are quotes right out of the document. These are not summaries. These are quotes right out of the document. Expand government-private sector partnerships to fund the vaccine agenda around the world. Now, this is what they said. This is the opening line of that document. The 20th century is the century of vaccines. The lifespans of Americans increased by more than 30 years in large part because of vaccines, and mortality from infectious diseases in the US decreased by 14-fold. Wait a minute. Wasn't it clean water? Was it really all those vaccines that saved all those lives? Or quite frankly, are the vaccine industry an economic loss leader because the drug companies' main drugs are going off of patent and be going into a generic sort of status? And if we can continue to make a certain portion of the population sick under the auspices and the guise that you must have this to keep you healthy, doesn't that allow them, they're another big book of business to sell them to you to make you a customer for life? So the National Vaccine Plan had 5 goals. Develop new improved vaccines, enhance the vaccine safety system. What do they say that vaccines about their safety fix them? What they actually say is deny that adverse events are exceedingly rare, and when they really consider adverse event to be a death, that's probably true. But they don't look at the long continuum of other types of illnesses that are caused along the way by vaccines. Support communication to enhance informed vaccine decision-making, conduct research and understand the public's resistance to vaccination. I can't tell you how many articles that have been published in the Public Health Journal over the course of about the last 3 to 4 years that are massive research projects like this. It's like, what's wrong with you people? Why don't you want these vaccines? What's wrong with you? We have to do this research to find out what's up. Everybody should want these. In fact, they want adults to actually demand to be vaccinated. That's part of the plan. And increase the use of the world vaccines worldwide. This is a slide that sort of sums it up. The CDU, 49 doses of 14 vaccines from the day of birth to age 6, and 69 doses of 16 vaccines between the day of birth and 18. I'd strongly encourage all of you to memorize that. 49 and 14 and 69 and 16, because that is one of the main problems. And if they start adding more and more of those 140 that are in the pipeline into that schedule, how much more travesty are we going to have under the umbrella of, oh, we can save lives and make people healthy, they never talk about how many lives are damaged and are made sicker by these vaccines. So 2010, again, well, this is the last little part of what that vaccine plan is, to ensure funding for a stable supply, look at financial barriers, have the government give more money, educate physicians so that they give more vaccines, and develop a program to ensure all healthcare professionals are vaccinated. Now, why did they add that one? It was because about 5 years ago or so that they did a big survey of physicians and nurses across the country to ask them what the ascertain what the vaccination rate was on flu shots. And I think that less than 50% of physicians got flu shots and something like less than 30% of nurses. What do they know? Well, we have to get that stopped, and so now we've enforced that by many of the hospital systems across the country. If you work in the hospital, you have to get a flu shot to keep your job. So now you're going to be forced to be injected with something that can seriously harm you or make you sick for life in order to keep your job, to keep a roof over your head and feed your kids. I got phone calls from people who said, I work in the IT department at the hospital in a building down the street. I never set foot inside that hospital ever, and I have to get a flu shot or I'm going to get fired. So this is what's in the development and what's happening. So why are these the roles and responsibilities of the government? Why has suddenly the government taken such a big interest in you and to make sure you are vaccinated? Because all of you filthy people out there who aren't vaccinated are spreading disease everywhere? I don't really think so, especially in the last about 4 or 5 months. There have been enormous amounts of articles that have been published showing that the vaccinated people are the ones who spread all of these attenuated viruses and can ostensibly make other people sick. And why do we have to pay for this? I mean, the government doesn't have a money tree, unless you call it, your tax returns. So we're paying for all of this stuff. So the next little piece here is about Healthy People 2020 and why the timeline is really, really short. The origin of Healthy People 2020 actually started back in 1976 with the creation of the Office of Disease Prevention and Health Promotion, which is still around. It's part of the HHS. The Surgeon General at that point in time took a health survey over all of the country and said, what is the status of the health? And those two documents, The Health of America and Promoting Health and Preventing Disease, became the cornerstone of what was called Healthy People 1990. And every decade, they would do this. And at that point in time, if you go back and read the 1990 one, it was about things like infant mortality rates, smoking, obesity, motorcycle helmets. I mean, things that probably needed some attention. So they set some goals and guidelines for the decade. For the Healthy People 1990 was from 1990 to 2000. And then they did a 2000 to 2010, and then 2010 to 2020. In 1990, there were 15 topics and 226 objectives. For Healthy People 2020, there are 42 topics with 1,200 objectives for the Department of Health and Human Services to get its little nose and fingers in every single area of every single person's life. The regulations are astounding. And what has happened with the Healthy People 2020 is that it has gone from being guidelines to goals. Instead of these are recommendations, these are becoming requirements through electronic medical records. So within weeks of release of the Healthy People 2020 guidelines in 2010, the Bill and Melinda Gates Foundation pledged another $10 million to research, develop, and deliver vaccines around the world, which fully funded the decade of vaccines. So 2010 to 2020 is considered the decade of vaccines, and we're on the other half of that now. And in the process of all of that, of thinking about all the ramp up of how we can deliver, we can get more funding for the Section 317 funding and get more kids vaccinated, because now we've got 16 vaccines we can give them. They went, oops, we forgot something. We forgot about mass vaccinating adults. So, in February of 2015, they released the vaccination program for adults. And these are the current vaccines that are approved for adults that are commonly given in the US. There are a couple more that are given globally, but those are the ones that are approved. And when they released this is what it said. The National Adult Immunization Plan is a 5-year strategy because they forgot. And they had to implement it in 2010. They forgot to put it in the beginning. And so now they released it in 2015 to vaccinate all adults with all approved vaccines and, quote, any vaccine that is approved now and in the future. This was part of the plan. 4 goals, 16 strategies to strengthen adult vaccine infrastructure, approve adult access to vaccines, encourage adults to request and demand vaccines. You need to walk into your doctor and say, I'm here today for all 7 of my shots. Foster innovation for more adult vaccines. So we'll drill down through those just a little bit. Goal 1, to strengthen the infrastructure. They want to collect all data on all ACIP-approved vaccines and recommended vaccines. Collect, note that word. The electronic medical records is like a swastika on your arm, man. They're tracking you electronically through everything you say in your doctor's office. Rapidly assess to vaccinate more pregnant women. Now think about that. Forever. Pregnant women shouldn't take an aspirin, take a Tylenol, take an antihistamine. You shouldn't drink pop, you shouldn't drink coffee. But now we're going to vaccinate you. With flu shots, HPV vaccines are in the pipeline, pertussis vaccines, now this whole Zika nonsense, anything to vaccinate pregnant women even more. And I happened to be at the conference in September of 2004, March of 2004, and the conference was the first international neonatal vaccination conference. But what are they doing to neonates, man? A neonate is defined as a baby from birth to like 6 to 8 weeks of age. So we're talking about vaccinating them more. So I actually went to that conference. I actually just wrote a big 3-part blog about it that's posted on the Vaccine Research Library. It's vaccineresearchlibrary.com website. And I remember being in the room when they started talking about, that was when the first plan started to come forth to vaccinate pregnant women. And I remember the people sitting up on the stage said, we're never going to talk the OB-GYNs into doing that. Never. They're never in a million years going to agree to give pregnant women a flu shot that has mercury in it. Well, they did. They said, we're going to have to put the fetus on the injury compensation program because if the baby comes out and something's wrong with it, somebody's surely going to blame the vaccine, whether it was the vaccine or not. We're going to have to put that on the injury compensation program. Well, they didn't. So that's the next big push, and it's part of the adult immunization plan to get more vaccines to pregnant women and develop model agreements to address the legal issues and policy barriers that preclude data sharing between states and the ISS system. What's the ISS system? It is, and all of that I just talked about is going to be done through your electronic medical records to send to the ISS system. It is the immunization information system that tracks all vaccines administered in a geographical area. It combines vaccine information so that if you can get a flu shot from the drugstore, at a health fair, they come to your place of employment and give it to you. And I'll have patients that say to me, well, it was free. It's like, they were giving out shots of arsenic that day. It was free. Would you have done that one too? It's free, so it must be good for me, just like a B12 shot or something. It will become the official immunization record for work, travel, school, daycare, camp entry requirements. And now they're trying to figure out ways to send this across state line through electronic medical record tracking. Because how that all happened was electronic medical record implementation would happen back in between 2000 and 2010, it was very expensive. I mean, in a 4-person, like a 4-physician doctor's office, it was anywhere from $40,000 to $60,000 per physician to install that into an office practice. And so, you know, the physician's offices are small businesses. It's like, well, where are we going to make this money back? The government came along and said, don't worry, we'll fix it for you. We'll install it, we'll absorb the cost, as long as you meet these goals over the next 10 years. Of checking all these boxes, vaccination status, glucose status, hemoglobin A1C status, did they get a mammogram, and you give us all that data, we'll pay for that for you. And each year that has gone on, up through 2015, when full implementation was supposed to start, there were more and more boxes that needed to be checked and collected electronically. So the electronic medical record is how all of these things are going to be tracked. So you can run, but you can't hide, really. The pediatricians now that are insistent on vaccinating your kids are being paid up to $400 by Blue Cross Blue Shield for completed vaccination record. Adults are going to come into that next. Don't believe me? Here's the document. Here's the document right out of Blue Cross Blue Shield Network Outcomes Preventive Health. It's called Combo 10. If kids under 2 years of age get all these vaccines before they're 2 years of age, in their eligible population, If 63% of those kids in a doctor's office have it, the doctor will get $400 per kid. Now think about that. That means if there's 100 kids in the practice, keeping the numbers simple, and 63 out of 100 of them get fully vaccinated with all of these, the doctor's going to get 40 grand for that. Now, think about that. It's pretty nefarious, isn't it? And isn't that one of the reasons, is this one of the reasons why, and this is just Blue Cross Blue Shield, I don't have any documentation, but I'm assuming it's similar for other types of health plans. Is this the reason why doctors are kicking their patients out of their practice who refuse to fully vaccinate their kids? Does it have anything in the world to do with the fact that they think the kids are unhealthy or unsafe or something? Or is it really more about this dollar sign down here? What about these other things? Is the doctor going to be hazardous to your health, your well-being and employment? Well, it's pretty good business for the doctor because in addition to this $400 per member if they get all of this, it's about thermograms and counseling about your weight and diabetes and all these other things that are little check boxes in your electronic medical record that get collated at the end of the quarterly, semi-annually, collect the money from Blue Cross Blue Shield. So this number 2 goal was to improve adult access to vaccines. They want to set up a fund similar to the 1993 Vaccine for Children program and the Section 317 funding for adult vaccines. And devise methods to encourage and incentivize doctors for recommending, providing, and recording adult vaccines in their medical record. And expand the network of those who can vaccinate. I thought this statistic was pretty astonishing. That currently 250,000 pharmacists are trained to administer vaccines, and nearly 95% of Americans live within 5 miles of a pharmacy. Remember a couple years ago when there was that big ramp up that Walgreens and CVS, it seemed like they were putting one of those up on every single corner? Well, this was part of the plan. So, number 3, increased community demand for adult vaccines, to promote and demand all vaccines, to educate individuals, to create a more robust electronic medical record to include standing orders, reminder calls, reminder mailings to remind you to get your shots. Encourage to develop the adult immunization champions in communities and across all sectors. If you read some of the things about school nurses and some of the documentation of what they're looking to use schools for in terms of not only vaccinating your kids, but it's like, hey, if you're dropping your kids off at school and you're here with your kids, let's just give you your shots while you're here too. That's why that ISS system is going to be so important to collate all that data. So the National Adult Plan was to specifically for adults to ensure steady supply of vaccines, develop new vaccines, making the existing ones better technologies, better delivery and shelf life. And so who's behind all this nonsense? I mean, who are these people that are so focused and emphasize that the only thing in health that's important is to be vaccinated? Not about smoking or alcohol or safety or obesity or diabetes or the food you eat, whether you're happy, whether you have any joy in your life, whether you have any love or anything, nothing else matters except for you to get vaccinated. Who are these people? Well, here you go. There's a whole bunch of them. All of these folks, HHS, Department of Justice, Veterans Affairs, Department of Defense, Homeland Security, the vaccine industry, Office of Minority Health, National Health IT, really? Office of Women's Health, Adolescents Health, Ministry of Health. All of these folks are the stakeholders that are making this happen. Now, there's the Goliath, but we're the David. We still can take these people on by just saying no and getting organized enough and getting the community educated and getting physicians educated to make them understand how much they've been bought out and paid off. There's a document that I read from 1933. It was kind of a spiritual book that I was reading in, but it was talking about how physicians have become the unwitting cat's paw for pharmakia. So I looked that up and said, what's a cat's paw? And it means an unwitting minion or agent. They don't even know. I can make a I'm not much of a betting girl, but I can make a pretty strong wager that there are 90% or more of physicians have never even so much as read a package insert. They don't know what the injury compensation program is. They don't know that they should be responsible for filing a VAERS report, even though anybody can file one. They don't know how to recognize a vaccine injury if one walked in the door and shook their hand and introduced themselves to them. Everything is something else, and I'll give you 2 quick examples. I've got 2 young girls in my practice right now. Both of them are injured by the Gardasil vaccine. One's 14, the other one's about 17. I was the 18th physician that each of these girls have seen. They're from 2 different states, they're not anywhere connected. Why does somebody have to go to 18 doctors to get a diagnosis of a vaccine injury and to try to do something to make them better? When, if you had a shot of penicillin or you had any other type of medication and you had a serious reaction to it, the doctor would go, that penicillin was bad for you. We're going to make you wear a medic alert tag and you don't ever get another penicillin the rest of your life or anything closely related to penicillin. But when it comes to vaccines, it's never the vaccines. We will send you through every blood test, lab test, x-ray, upper, lower GIs, neurological programs, look for POTS syndrome, all these weird zebra stuff, just because it can't be the vaccine. This has to stop. So are we going to become a show me your papers society? I mean, it's a couple of the articles that I've read when they talk about this implementation plan. Now, I want to reinforce what I'm going to say here. None of this has happened yet. None of it has even been in a place of legislation yet. But in some of the public health journals, this is some of the things they've talked about. That unless you're fully vaccinated, maybe you won't be able to renew your driver's license, or your passport, or go to a public sporting event, or to the grocery store. Or you're not going to be able to work anywhere where there's people, like a clerk at Penny's or at the bank, unless you're fully vaccinated, because you're exposing all these people. This is the nefarious plan of all these people to get everybody vaccinated. And in my opinion, to make everybody sick so that they've got this other big book of business that you become a customer for life. Are we going to be doing that? Are we going to be so subjected to all this stuff that we can't go in and trust our doctor to tell our doctor that you're sick or you're this or you're that, because it's all going into that electronic medical record being fed back to somebody? Because those electronic medical records are not HIPAA compliant. They're blinded, they don't have your name on it, but the data is collated, and there's something like there's over 2,000 different organizations that can access those records, like Humana and all the big health, all the big insurance companies. Are we going to be at that point? Well, actually, I love this quote from James Madison. If tyranny and oppression come to this land, it will be in the guise of fighting a foreign enemy. And whether we're talking about politics or Zika virus or something like that, it's tyranny of what's happened to our medical program. Our doctors have become unwitting cat's paws of pharmacia. They've bought into it. And you may love your doctor. You may think your doctor's the greatest person. He's a good guy or gal. You invite him over for Christmas. That doesn't mean they're educated. That doesn't mean that they know of this information or have even spent 20 minutes of their time looking into it. So I encourage the practitioners that are here, or anybody that knows a practitioner, to gently, or maybe not so gently, urge them, hey, listen, you need to look at this. We've got the sickest generation of children ever, with more asthma, more allergies. I mean, the American Academy of Asthma, Allergies, and Infectious Disease is off the roof with the number of kids that have eczema and allergies. And do you think it just might have something to do with those 49 doses of 14 different vaccines they get by 6 years of age? And why isn't anybody talking about that, or at least examining it? Instead, it's like, no, it's not the vaccines. It's the dust mites in your house. It's the cat. It's the whatever. It can't possibly be all those shots that they got for birth going forward. And now we're going to pass laws like SB 277 and make that across the country. Now here's the scenario, and I'm almost done with this. Imagine this scenario. Any doctors sitting in the room or practitioners in the room. Imagine it's one of your kids. Maybe you have 3 children. And your first child, you've fully trusted the system. and you fully vaccinated them, and they had a horrible outcome. Maybe they have a long-term seizure disorder, maybe they have horrible neurological problems, maybe they died. Maybe you even went so far as to file a claim in the Vaccine Injury Compensation Program, and you were compensated. Now SB 277 is telling you, so what? You gotta vaccinate your other 2 kids. It's the only area of medicine that I'm aware of that really does not fully embrace the concept of family history. When you go to the doctor and they talk to you about breast cancer, anybody in your family have breast cancer, colon cancer, hypertension, anybody has chronic migraines, always these things about family history. Now we're getting so much more tuned into genetics, like through 23andMe and Ancestry.com, that makes it so easy for people to have access to that. Well, I've had parents who said to me, my husband and I both had vaccine reactions when we were kids, and we've got all these autoimmune problems, but the pediatrician is forcing us to vaccinate our kid. No family history is taken into consideration, no consideration to possibly other siblings that had bad reactions. It's just vaccinate. And truth is the new hate speech. The further society drifts from truth, the more it will hate those who speak it. So why do you care if people hate you? Why do you care if people unfriend you on Facebook? Why do you care if people delete you from their Snapchat account? If you're telling the truth and you're doing the very best to your circle of people, because all of us have our circle of friends, to try to educate them, get them informed, tell them to stop, wait, investigate before you vaccinate. I mean, seriously, I know how very few, if any, people who have seriously investigated problems associated with vaccines and have gone ahead and done it anyways. They may be horrified and scared of, say, I don't know, polio or something, and want their kid to get 1 vaccine, but they don't get the 14 doses of 49 vaccines. And don't allow your doctor to bully you. We now have laws and rules and regulations out there about bullying. And I've actually challenged some people to say, if you're in a pediatrician's office or a family doctor or whoever else doctor, and they are bullying you into doing something and trying to scare you into, if you don't, and you are forced into something like that, you should scoop your kid up and walk out and go to the local phone booth and call the state medical board and report them for bullying. And if we start doing more than that, then maybe it'll stop. Physicians, the Greek word for physician is supposed to mean, is teacher. Physicians are supposed to work with you and educate you and help you understand things. They're not supposed to beat you up or frighten you or kick you out of their practice or something because you don't want to go along with their advice with what you're paying for. And if you don't like what your doctor's telling you, there's a bunch more of them, go find another one. Or find a healthcare provider like a naturopath, or a pediatric chiropractor, or a nurse practitioner, or some other type of healthcare provider that you don't need to go to a pediatrician for. So, if you talk about truth about vaccines, you get hated, geoengineering, GMO foods, fluoride, stuff. So, what can you do? You saw that long list of people. We have limited time. These Healthy People 2020 things have become goals, not guidelines. The adult vaccination plan is coming. There's another thing called Agenda 2030. You can Google that and find it, but I really kind of warn you, don't read it before you go to bed at night. It's kind of creepy. Get politically involved. I know there's probably lots of people in here who fought very hard for the SB 277. But here's what I tell you, there's lawsuits that are going on right now. One was just filed this week in LA. The SB 277 lawsuit is moving forward. They're getting involved with organizations to help fight that. Think about it this way. I had somebody tell me when we spoke at CalJam, this guy came up to me and goes, yeah, I worked really hard. I went to Sacramento twice and it didn't work. I said, so let me turn this around a minute. Let's say that it did work, that all those parents who went down there really made a difference and their legislators voted to not pass SB 277. Do you think the vaccine companies would have said, well, no, we give up. We tried it, didn't work, didn't pass it, well, so what? You think? Well, we have to think like they do. If they wouldn't have given up, we can't give up either, ever. organizations, wake up your community, use a lot of the things that are here. I mean, I know Dane's making all of this available for free. We're recording all of this, and it's all going to go up on YouTube. He's going to chunk it out in little chunks. It's going to be available for everybody for free. Post it on your Facebook pages. Put it out on your YouTube channels. Burn it to a CD or on a thumb drive and hand it out to people. Put it in places. Take it to your local public libraries and invite some people in to start listening to it. It's all there for you. It's all going to be, all of this is going to be there for you. Wake up your family. Get your kids to understand the importance of fever and why childhood infections are all about. I wrote a paper, it's out on the internet somewhere, it's called The Importance of Fever. And it's really important to understand that, guess what, your kids are going to get sick. So what? It's going to happen. All of us had sick at one point in time. We all had ear infections, cold, cough, whatever. Talk to your extended family. Talk to your mom who raised you. What did you do for me when I was a kid when I had a fever? Did you run them to the pediatrician and get an antibiotic? No, you gave them some chicken soup and held them and put them to bed and gave them a cool bath and they were better in a day or two. You know, we don't have extended families anymore in the physical, but we have extended Facebook families. So ask your Facebook friends who have 5 or 6 kids. When you're a new parent, you're really afraid of a lot of these things because it's a brand new experience and you got this little thing that you're responsible for. So talk to other people who've been through it. Get their advice. You don't have to run to the pediatrician for every little nit switch, really. So, and this is the 2 most important things here that I want to close with. Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it's the only thing that ever has.
Yeah.
Ever has. Think about things that have been floated over the years that have gone away, that laws have transformed. Smoking laws, you know, that you've got smoke-free hotels. You know, I don't know what your politics are, but, you know, gay marriage, it came a long way. You know, it took a lot of battles. You know, slavery went away because a small group of people said the black African slave trade, we can't do this anymore. You know, there's people out there fighting for human trafficking. There's a lot of issues. There's GMOs, there's geoengineering, there's fluoride, there's vaccines. Pick one and give it your all. And you don't have to do it full-time like a full-time committed job, but maybe you've got 2 or 3 hours a week that you can really commit to activism for something you believe in. Give it that 2 hours a week or 3 hours a week consistently every week and give it your all. And then if we have 1 million people, 2 million, 10 million people doing that, we will change the world. We will change the world. And this is the most important thing. It's better to walk alone than go with a crowd going in the wrong direction.